Hi, everyone. So we're going to go ahead and get started on today's part of the series. So we're always talking about COVID-19. So if you want to know more about COVID-19, which some of you might be really tired about hearing about COVID-19, I urge you to stay engaged and stay tuned because things are always emerging, new things are always coming out, and COVID is going to be with us for a while. It's been with us for already 2 years. So we're probably tired of hearing the term, but there's always new information to talk about. And today's hot tea is going to be talking about COVID-19, specifically from a transmasculine perspective. So we have a special guest with us today, and I'm going to allow him to introduce himself in just a minute. But I really wanted to kind of focus today's session on looking at COVID-19's perspective and its impact on different variety of communities. So if you think about COVID-19 affecting the entire world, then you look at affecting the different countries and different structures. Then you have specific populations, right? Especially communities that have access to vaccines or don't have access to vaccines, access to information and in languages that they understand, for example, whether it's Spanish or even indigenous dialects. So we have to think about it from a multifaceted perspective, but today's focus will be looking at COVID-19 from the perspective of transmasculine communities, specifically Latino transmasculine community. So I'm glad that we get to partner with Trans Latina Coalition in bringing in this information. So once again, this is our session for August, and we're glad to see you again. And we hope you come back in September, which we'll be doing a little bit sooner around September 20th. So stay tuned so that you can get that information. And let's start off with our guest. Hi, Byron, how are you? So Byron is our translator, and I just wanted to give a shout out to La Byron.
Hi, thank you.
She is always hooking us up with making sure that we are culturally sensitive and getting this information out to you in Espanol, in Spanish. So we're going to start off and introduce our special guest today. Our special guest today is Lucas Rojas, who's a researcher and consultant, and I'll let him talk a little bit more and introduce himself.
Hi, everybody. It's nice to be here. My name is Lucas Rojas. My pronouns are he, him, and they, them. I wear a couple of hats. I am a researcher over at Children's Hospital, LA, at the Center for Trans Youth Health and Development, doing research specifically with trans youth and LGBT youth in general. Not only that, but I'm also the International Director of Operations for Flux, an affinity group for AHF, dedicated in creating safe spaces and as well as advocating for community. And then myself, I am a transmasculine Latinx individual.
Well, Lucas, I was going to call him Luquitas. That's my name for Lucas, Luquitas. So Luquitas, you also got to present at the biomedical conference this year. You want to share a little bit about that? Because you're also part of NMAC, right?
Yeah. So I also travel sometimes to conferences presenting on specifically with transmasculine communities, disparities, whether it be in HIV care, healthcare, anything the transmasculine community, we see disparities not only in the Latinx community, but in general with overall transmasculine community. And that's one of the things I focus on is creating surveys and creating studies that are dedicated for transmasculine folks that are created by transmasculine folks.
Awesome, great. Well, thank you for all the work that you do and for being able to share your professional role. We're gonna transition into talking a little bit more about like your person and your individuality, but also your own personal experience with having to deal with having COVID. So thank you again for being vulnerable enough and for having that discussion before we were coming on air. And then you're going to talk to us a little bit about statistics that you found out about COVID, so which is in your realm in research. So thank you again for sharing your expertise and welcome to today's session. And we're going to go ahead and go on and talk about first the hot tea. So we wanted to share with everyone what's going on in the world. So if you haven't heard, Moderna, which there's 2 camps of vaccines. And since we're talking about COVID, we thought this was relevant hot tea, is Moderna, one of the makers of one of the versions of vaccines that was utilized here largely in the United States, is suing Pfizer and BioNTech over the COVID-19 technology mRNA delivery system. So you're like, ¿qué es? ¿Con qué se come? What is that? What did you eat that with? Basically, the technology that's used with RNA to deliver the vaccine into our cells, apparently Moderna is saying that was ours. It was our technology, and Pfizer, you tried it. You went and used our technology and made sure that you made and profited during the COVID-19 pandemic, which we're still in. A lot of people think it's over, but we still have a lot of COVID-19 transmissions happening. But just wanted to share that too with you, because it's interesting that they definitely didn't sue each other during, you know, the hot time of the pandemic during 2020, early 2021. But now the gloves are off, and Moderna and Pfizer are going to court and coming for each other because the girls are fighting over that technology, mRNA delivery technology. So we'll find out in court. We'll keep you posted, of course, because anything that has to do with COVID-19, this is your channel to be able to discuss that. So again, that's the hot tea off the press. So now let's talk a little bit about Lucas and your experience in particular with COVID-19. If you don't mind telling us a little bit of your personal story of like the first time, because I believe you shared, did you have COVID-19 twice? I don't remember.
Yes.
Yeah. So if you could share like what it was like the first time, what you felt, what was your experience?
Sure. So the first time I got COVID-19 was, I believe, was December of 2020, which was before vaccines were actually available. I was actually scheduled to get the vaccine 4 weeks later from.
Sorry.
Yeah.
Can you hear us?
Yes.
Oh, okay, good. Our audio's good.
Yeah, so I was scheduled to get the vaccine a few weeks before I caught COVID. I'm sorry, a few weeks after I got COVID. I work in healthcare, so we were prioritized to get the vaccine. At first, I had gotten over some allergies, and then the next week after, I started experiencing fevers, chills, and basically COVID knocked me out for 15 days. I lost about 15 pounds, couldn't eat solids for about a week or so. It felt really bad. And since there was no medications to kind of diminish COVID-19 symptoms at the time, or even, vaccinations available, I just kind of powered through it. I was in bed all day, 7 days.
So Lucas, you and I get to work in a lot of spheres together, and we were at a retreat during that time together for an organization that we worked together with. So we were all at a retreat with other people. We all had tested, we all had gone together, and then you came out COVID positive. And how did it feel to be like the first one in that entire group? Like, what was the reactions, and what did it feel like?
I think it felt like part of me wasn't sure at what time I got COVID. I don't know if it was when I was experiencing symptoms of allergies during the retreat, because I had experienced some symptoms of allergies, and then I was okay for a few days, and then symptoms of COVID started, right? They're very similar symptoms, so I wasn't sure. And then my second fear was like, did I just infect everybody at the retreat? Because we were very close-knit. We're together for, I believe, 3 days. So my fear was like, at what point did I catch COVID? And at what point are these people possibly infected with it? Am I patient zero, basically?
Yeah. What did that feel like for you? Did you catch any slack?
I caught a lot of slack from everybody, especially because it was during Christmas time. When I found out it was actually Christmas Eve, I believe, I found out I had COVID because I went and got tested at work. And they told me the next day, they're like, you got COVID. So then I had to send everybody a text, and then everybody was complaining because they were all with family. So.
Wow. Well, Lucas, you're very popular. No, I'm just joking. So, well, thank you for sharing that personal story that first time you got COVID. I definitely know that, but being part of that retreat, one of the discussions for us was like getting immediately tested. So it's a good opportunity for us to talk about like, definitely people think like, oh, testing is over, COVID is over. And it's a great time to think about really with your family and friends, especially those that are most vulnerable to them to be older or have compromised immune systems that are at higher risk to have more serious complications from COVID-19. I vividly remember your text and being like, okay, then I cannot be around family. It's Christmas time. I immediately went and got a COVID test. What are they called? Not the androgen test, the PCR test. And luckily I was fine. And I tested again 4 days later and I was fine. But going back to your personal experience, I remember you shared with us, what are some of the things that lingered, like some of the symptoms you mentioned? You were tired.
I was tired. I couldn't breathe well. So my hobby is I do weightlifting and I do CrossFit. So I wasn't able to do those things for 14 days. I tried working out at home. I was short of breath. You know, everything, even just walking felt like a hassle for me. It was more of like me running out of breath, like if I was running the whole time. So it's like trying to figure out my oxygen levels. I had to get an oximeter so I could check my oxygen levels to make sure, I was okay. And for the longest time, even after I got over COVID and I tested negative, I had to rebuild that oxygen tank in me to kind of see like, it took me a few tries, especially the first couple of weeks in the gym. I felt like super weak. I felt like everything was a hassle for me. Like I was always running out of air. And then also I lost my smell for a while. I actually lost my smell for 6 months.
You think you lost smell for 6 months?
Yeah.
Did that affect your taste or just your smell?
No, it's just my smell. I know for people it's different.
So te echabas un pedo y no lo olías.
No,
I'm just joking.
Yeah.
Wow, like completely lost it or like?
No, I completely lost it for 6 months. It wasn't until like probably month 6 I started smelling stuff. So for 6 months I was like, no smell.
Well, thank you for sharing that. That's kind of scary. You didn't get scared?
I mean, I'd rather lose my sense of smell than my sense of taste. I love food, so.
Well, that's true. But damn, I like to smell my food before I eat it. So I don't know, that'd be kind of weird for me. But okay, so that was your first experience and you had 2 bouts with COVID. Wait a minute. So this was December before the vaccine, but then you got vaccinated?
Yeah, I got my first shot in that, I believe it was January 10-ish. And then I got my second shot at the end of January.
And then you got COVID again.
And then I got COVID again, but that was more towards the middle of the next year. Or that same 2021.
And how was that one?
That was actually not bad. I didn't get any symptoms. I stayed home and pretty much, the vaccine's not meant to, like, it's supposed to diminish like what you experience with COVID, the symptoms you experience with COVID. It doesn't 100% guarantee that you won't get it. It just minimizes the risk of you getting it. And if you do get it, minimizes the risk of you passing it on to people as well as, the symptoms you experience. Luckily, I didn't get any symptoms for the other one. And it was my partner at the time who gave it to me because she worked at a grocery store.
Oh, wow. Well, thank you for sharing that, for sharing the second experience. But you made a really important point. So you can be exposed to COVID and not necessarily be infected, right? Mm-hmm. So once you have acquired COVID and you are indeed infected, the vaccines, you made a really important point, are meant to diminish the symptoms, the severity of the symptoms, so that you don't, get as sick as you did the first time. So thank you so much for sharing that information and for sharing your personal story. Because, a lot of people don't get to hear, particularly from our trans brothers, our trans masculine siblings. And I wanted to even talk a little bit about that because it seems that in our community, some of the last members to get that information, it seems like a lot, when everyone talks about trans health or trans people, they talk about trans women, right? Not trans men, trans masculine communities or non-binary communities. I think, why should that change?
Why should we be inclusive of trans masculine populations
Yeah.
in general? I think for a lot of time, there's been dilemma whether it be trans feminine folks taking up space, which is not the case. I think it's more they've needed the visibility at the time because a lot of things happening, trans women getting murdered. I also think including trans masculine voices is very important in its own side, where we still have issues going on, whether it be health, not all insurances do offer surgeries. Not only that, but accessing like healthcare and the lack of things we have for the trans masculine community, such as PrEP. There's still certain PrEP medications we can't take, and we're often excluded of research when it comes to PrEP. As well as spaces. When we talk about HIV prevention, we're often excluded because, quote unquote, we are not high risk, even though we may sexually partner up with people who are deemed in the high risk group.
And I guess I would want to drill down on that because you mentioned PrEP not being available and pre-exposure prophylaxis having to deal with HIV. Which is another pandemic that now is endemic in our in our society. Now COVID-19 is another pandemic that is also endemic in our society. It's not going away. It's become part now of the fabric of community. A lot of resources go to educating like different populations, hard to reach populations, and some of those prioritizations sometimes when it trickles down to trans people go to trans women. How can we be more inclusive of trans masculine individuals when we're talking about particularly, HIV or COVID-19, for example, COVID-19 vaccines to be exact?
I think being mindful, just in general, like being mindful of what populations you're including when it comes to not only research, but when it comes to treatment, right? Whether it be COVID vaccinations, thinking of like, okay, my name is not legally changed yet. How does that look when you're coming into the doctor's office? Am I going to get misgendered? There's that fear of medical mistreatment due to legal documents not matching your identity. It's not like, especially if you don't have your name or gender changed legally, it's hard for you to walk to a CVS, right? Go get a shot and think it's going to be okay, right? You have a lot of, are they going to misgender me? Are they going to deny me because I'm trans? A lot of factors that deal with it. And it's not only inclusive of the trans masculine community, but it also affects everybody in that trans community, whether it be non-binary, trans feminine, trans masculine. And I think we often forget, people when we're navigating healthcare systems, what barriers are we facing as trans individuals, and how does it affect every demographic on that spectrum?
Interesting. You made a really important point. Like, you're right, like our vaccine cards were issued with our ID attached to it, at least here in the state of California, which just want to take a pause and credit the state of California for being a funder on this project, for being able to talk to communities, specifically trans and non-binary community, through Trans Latina Coalition about COVID-19. So shout out to the state of California for stepping it up and being a state that's in collaboration, in camaraderie with our trans and non-binary community. That being said, our IDs were required to get these vaccine proofs, right? The little white squares that now everybody has the opportunity to have. So you're saying, like, so if I showed up and my name was Jose, for example, that's what would be issued on my card.
Exactly. And then you have to worry about also, like, let's say if between your shots, right, you got your shots and then you got your name changed, and now you go by a different name, you go by your firm name. How does that work, right? Because your COVID card has your original old, your old name. So at that point, how do you go about accessing that healthcare system to get that changed? So because not only will it show up in the card, it shows up on the Department of Health system.
Wow, great point. Like, I don't think a lot of people, we sit and think about that, especially if you've been privileged enough to change your name and gender and have access to that. But if you are, part of a migrant population, for example, and you're coming to this country and maybe you haven't adjusted your immigration status or changed your name, how do you navigate that, especially if you need a vaccine proof to travel or to enter somewhere? Wow. Things to think about. Well, thank you for bringing that important poignant point up, Lucas. So we're going to move on to the rest of our talk today and the rest of our training and our conversation. So one of the things that you mentioned, and it's funny because we're going to transition to talking about long COVID. So one of the things that many people don't get to talk about, or we're still looking at what are the impacts, because COVID is new. As of 2019, 2020, early 2020 is when we first started hearing about this, a virus that came on the scene and really changed our lives across the world. But long COVID is still being looked at. And some of the things that came up, ironically, and you mentioned, Lucas, that you experienced this for 6 months, is loss of smell, head fog, which means a difficulty in concentration and being able to manage pattern thought and being able to remember things. So obviously that must be impactful also even in just output in work. Loss of lung capacity. One of the things you mentioned, I believe, was that you had some difficulty when you started working out, because working out is part of your routine, that breathing was a problem. Sleep problems has emerged as one of the long COVID problems. And one of the other ones that was mentioned that stood out to me, and there's a whole list. So if you go Google, you will find a lot of symptoms from long COVID. Do not be a hypochondriac and self-diagnose. You want to make sure you get a COVID test. You want to make sure you speak with your physician, your primary care provider. But one of the things that stood out to me is funny because, like, knock on wood, as they say, I haven't had that opportunity to test positive for COVID, thankfully. I don't want to. But ironically, I started developing a really weird rash around the beginning of 2020, mid 2020. And it just was a reoccurring high rash. And I was thinking maybe I was COVID positive with not a lot of symptoms, but unfortunately, I didn't get tested at the time. So just wanted to share some of these long COVID symptoms so that people could be aware that, COVID has an impact. Even though you might think, okay, it was a little cold, I didn't feel as much, I did knock me out for 15 days. Some of the things that people are sharing that are happening out there. All right, so I don't know if you need to share your screen, Lucas, or what can you tell us from the research perspective? What does the research say so far about COVID?
About COVID relating to trans folks?
COVID in general and some relating to trans folk, if we have any data.
Yeah, so I've particularly looked in research relating to COVID with LGBT youth and young adults. So what we found, we did a lot of qualitative studies. So that what that means, we just got people's experiences. Right now, we don't have large enough numbers to have any quantitative data. We're working on that next.
So just so that, I'm sorry, I don't mean to interrupt you, but so qualitative research and data means stories, not numbers. It means like quotes, how people are feeling, what they're thinking, their experiences. And quantitative data means numbers.
Yeah. And that's still something that's being researched, because research takes a while to get, not only to create, but also to get people to do it and make sure, especially for the research that we do community-based research, which we want to be intentional of including all trans masculine voices in that research, at least for the studies I do. So we're in the stages of creating that research, which will capture COVID data about what people did during COVID and anything they accessed. But we have done some qualitative studies where we've interviewed folks, and there's been a couple studies that have interviewed. There was one study, let me double check the name of it, that was done and they conducted 20 qualitative interviews with trans-masculine folks. And it was found that during COVID-19, none of them, except for 3, were able to get STI HIV testing done during the pandemic because it was all closed down at that time. And then a lot of them had surgery scheduled and were canceled during pandemic as well.
Wow, I didn't think about that. So you basically, so these qualitative studies are talking to people's experience. So there's trans individuals, for example, that had a date for like February 20 or like, April 2020, I'm getting, top surgery. And that was canceled. So obviously that would trigger dysphoria and other things. Like, yeah, I didn't think about that either. Like, what else happened?
Yeah, so you had a lot of people, staying at home. People weren't seeing, like providers weren't seeing people in office. It was all being done through telehealth. So if you wanted to go in for STI HIV testing, you didn't have access to that, at least for the first few months. So then it was more of like, if someone was experiencing symptoms, where do you go to get treatment, right? Because no one was offering treatment at the time, for sure. And then also for people that would see their therapist for gender, or even see their medical provider for gender affirming care, weren't being seen in person. They were transferring over to telehealth. And even the first few months where COVID came out, we didn't know how to navigate telehealth, right? Telehealth wasn't a thing that existed. We adapted to create telehealth to deal with, seeing patients in a COVID safe environment.
Like, what are some of the specific, for example, solution? What are some of the good things that came out of telehealth and some of the things that you think are that you need to see people in person for sure?
I think some of the good things about telehealth that came out is they created more quest labs around the area. So basically you could see your provider from telehealth and go get labs done somewhere else. So that was one of the good things that happened. It made it more accessible. So let's say, for example, we have a department here at CHLA, Center for Trans Youth. It's in Sunset in Hollywood, but that might not be accessible for people living in Lancaster. It might not be, we have patients from all over. We have a patient in Japan. So then what makes it accessible is they're able to go see the doctor through video chat, go get their labs done. The lab sends it over to the doctor prescribes whatever they need, right? Whether it be hormones, whether it be, medication they might just need. Right? So basically it's streamlined it so it's accessible for anybody. And if someone has COVID, they could just do a telehealth visit.
So just to be clear, and so we could recap this section, we're talking about research, and you mentioned that there has been some qualitative studies that have been done, but not necessarily any empirical data, any like numbers that are quantitative. Yeah. There's a saying that sticks with me that was put forth by Melinda French Gates, the former wife of Bill Gates, and she said, "We measure what we care about." So do you think that people don't care about trans communities? Is that why we're not getting research, or what? Why do you think we're not being involved in research?
I think a lot of research, especially with trans community, has been really focused on HIV prevention and HIV care. That often we forget that trans folks not only are affected by HIV, we're affected by daily life as well, right? COVID-19 affected us, LGBT community in general, and specifically those that are unhoused. The trans youth, the LGBT youth who are unhoused lost a lot of stuff as well. They weren't able to access shelters regularly like they would, because during COVID, a lot of things shifted around, right? So we often prioritize HIV care, and then during COVID, people were more worried about finding the vaccine for the COVID, right? So a lot of research went to that. And then after now, we're barely gathering that, okay, we need to gather data on how people dealt with COVID.
Awesome. The other population that nobody talks about in both transmasculine or trans femme communities, the sex working community, right? Like from what I heard is during COVID, sex workers didn't have an employment to fall back on, right? Especially if they're long-term sex work community and sex work is work. Like what are your thoughts on like how that was handled? Because I heard that COVID kept, people kept doing their work. They had to.
Yeah. I think for folks that are involved in sex work, right? And at that time during COVID, it was hard because a lot of people weren't seeing clients, right? Clients didn't want to go because of COVID. And it wasn't until the vaccinations came around that people, especially sex workers, once they got that vaccination, they felt a little bit safer about seeing paid clients as well. And, a lot of clients that were, that people saw where lost their jobs too, right? Everybody was affected by during the pandemic.
Mhm.
So then,
I guess the reason I brought up that question is just like, it seems that researchers keep missing the mark, whether it's an HIV or whether it's COVID, right? Two different diseases, two different things. I'm not conflating them, not comparing them at all. I'm just saying like, it seems that any type of research, sex workers are not, it seems like it's not a population that is involved in the research project or targeted, which is funny because I feel like sex workers have, a Rolodex of individuals that they're able to intersect with and would be great PIs, great, investigators that can be partner investigators with any kind of research study. At least that's my personal opinion.
So I think that's valid too. And I think there's that intersection, right? That they bring a lot of knowledge due to their experiences. They're also a hard to reach community, to be fair. When people, this is a population that has a lot of medical mistrust, a lot of mistrust with services. So question is, where do we find this population? How do we incentivize them in a way that they're worth, right? We don't want to give them food vouchers or anything. We'd rather give them cash over, gift cards and stuff like that. And then what grants can we get for those populations to kind of make studies for those populations? Because there's no specific grants that are geared towards population, even though it's a wealth of knowledge we would be getting.
Well, we need to change that. I hope that out there, people that do get to hear this is that we advocate for sex workers being part of research studies that have to deal with public health. They're part of our community, and we need to make sure that happens. That being said, like you work in research projects, are there research projects right now that people can sign up for, especially if they're transmasculine and are possibly hearing this?
Yeah, we have a couple of research. We have at CHLA, we have for transmasculine folks, we have the Truth Study, which is for trans and non-binary and gender conforming, gender non-conforming and gender queer, gender fluid. Everybody in the trans umbrella, people of color. Basically, we're looking for people of color, and the study is a 5-year-long study. They're looking at, it's an observational study. They offer HIV, STI testing, and they're looking at any barriers to healthcare that this population might have experienced when getting services. And they also do COVID surveys. So they ask questions about how you dealt with COVID, what services did you access, what were any barriers during COVID, to kind of get your input.
Awesome. Well, since I'm learning so much from you, I hope I get to teach you too, because I know you're a researcher, so everything's official, but the term that makes it easier for us is QT-POP, queer, trans, and people of color. So that might be helpful in the future. Thank you so much. So if you are still awake and still with us, because research can be sometimes tedious, but super important for our community, we're going to go on and change the subject. So is it worth getting vax still? So I'm gonna be honest, right? Like for me, it's just like thinking about another vaccine. Now we have monkeypox in the scene. And it's funny because we take for granted that we've gotten different vaccinations throughout life, but it seemed like just with COVID, it made us think like, oh, here it goes again. But it's really, 3 shots out of them. I don't know how many thousands of hormone shots I've had in my lifetime. I think it's still worth it in minimizing the impacts of, of COVID. I also think it's worth it in minimizing the chance of spreading COVID to others. Is it tedious? Yes. Is it still worth it? In my personal, humble opinion, yes. So I wanted to ask you, what did you think about it? Is it still worth getting vaxxed?
I think definitely it's worth getting vaxxed. And I know, especially in communities of color, it's hard to like think about like, are vaccinations worth it? Are they effective? From my experience, right? I have family who's not vaccinated, and that's something that I struggle with, right? Because I like to keep healthy for those people around me, because I do attend a lot of events and I deal with a lot of community. When I think about getting vaccinated, I'm not thinking of my health, I'm thinking of those around me, kind of thing. And
Awesome. So you're weighing in on yes, it's still worth it.
Yeah.
But you mentioned your family's not vaccinated. So you're talking about like immediate family, or why they just said to say no?
My immediate biological family is not vaccinated. My chosen family is vaccinated, very much so, but they're very religious and don't believe in vaccinations. They're a little bit of an anti-vax. Well, there are a lot of anti-vaxxers, actually.
Oh, they're super anti-vax. Oh,
Yeah.
wow. So they're gonna pray the COVID away.
Yeah, pretty much.
Okay. Well, I ain't here to yuck anybody's yum, but okay, I'll stick with science for me. But okay, so still worth it for both of us. So good to know. We'll see. We'll put it out to everyone out there. So have those conversations with people. I always think that courageous conversations create change, and that's why we also are doing these conversations, these trainings through Trans-Latina Coalition, funded by the state of California, to talk about COVID-19. Even though it seems like a tired ass subject, it's not. It's still super important, because it really talks to where we are as a country, where we are as a people in the world, around how do we discuss difficult subjects, and getting vax is one of them. So bring it up next time they're at the table. Just don't come to blows. Don't do it while you're drunk. Okay, well, let's go on to the next slide. So these are some of the trans-specific things that we kind of listed beforehand. And Lucas, if I'm missing any, please let us know. So one of the things that we covered earlier too is vaccines and your name and your ID. Sometimes if they're discordant, it could be an issue because in your record is not there. For example, I'll give you an example. I got vaccinated really early on. Thankfully, I had the privilege of being able to get vaccinated like practically when they first came out. And I got my second vaccine after that. Both of them were at a fire station, which was like a pop-up basically, for all better terms. It was a pop-up where you show up, you get vaccinated, and you're good to go. All of that happened early, early on, and I took my vaccine. Went on my merry way. I lost my original card. When I went to try and get another copy when I'm getting my booster, they're like, we can't give you one that is backdated. I knew the dates because it was on my app, but they're like, nope, sorry, lady, we can't write it in the paper for you. We could just write in that we gave you the booster because that's what we gave you. That was a CVS and Olympic, and I won't forget because that pharmacist has an attitude. But that's a whole other subject. But I have an attitude too, I gotta say, just a little bit. So anyways, I was not able to list on my new paper my other 2 vaccines. I'm gonna be honest with you. I had to go and look at a picture of my old card and write it in myself. But things like that happen because like the space didn't exist anymore. And imagine if I hadn't changed my name and gender, how much more serious that is. I also have the privilege of being able to travel for work internationally. And here in the US, it wasn't as stringent as in other countries where it was required to enter a restaurant. You had to have your vaccine card, like your physical vaccine card, to enter restaurants. So that was very interesting to me. Also, one of the things that came up for trans-Pacific barriers to accessing COVID-19 vaccines or information was finding a place that is trans-affirming. Most places that we looked at were not either, they didn't understand, like if you haven't changed your name and gender, what that would look like. They didn't understand, some people are tired of taking shots because we have to take hormone shots all the time. So how would those interactions be with hormone replacement therapy? Like nobody was willing to talk you through that process. And then the other question that really people weren't answering is who should get vaccinated? Obviously we had heard what the general news said, but also like luckily we're getting to age, our median age is increasing in the trans community as it was before. So we haven't talked about like trans elderly people, and then monkeypox comes on the scene. And people are still, again, not really focusing it on like trans masculine, trans femme, and the sex work community that needs to have access to these vaccines. So these are some of the trans-specific things that I know that I found when we were doing our research. Is there anything that I'm missing, Lucas, that you wanted to weigh in on that might be trans-specific barriers?
No, I think you got that.
Yeah, I think those are the major ones. Or also, we wanted to make sure that we never leave you without any resources. So one of the major things that we like to do for sure is leave people with resources. So if you are interested in getting vaccinated or getting a booster shot, make sure to go to carbonhealth.com. You can also go to Trans Latina Coalition, and you can find their website at translatinacoalition.org, all one word. Also, you can make sure to contact St. John's Community Health, particularly the St. John's Community Health Transgender Health Program. That's what THP stands for. Quick Google search will get you their contact information, and they are also providing COVID-19 vaccines. If you're interested in getting monkeypox vaccines, Trans Latina Coalition is offering them as well on Wednesdays, and St. John's Well Child and Family Center has launched a new application which you could make your appointment online and get your monkeypox vaccine as well. An additional resource that we found out today is Children's Hospital is continuing to do research with our trans community and also is collecting information on COVID-19. So if you're interested in being part of research, a community-based participatory research, that is incentivized. You said an incentive. Is it something you can share or?
Yeah, definitely. So for our Him and Truth, so this is not just for trans community, but also for young queer men as well. And it's basically the surveys every 6 months. This incentive is up to 110 each visit. So
cool. So $110 just to come and see you. Do we see you in person or is it on Zoom?
You could do both. You have the option of doing virtually or do it in person.
Awesome, great. Is there any way people can reach out to you or get information? Is there a website?
Yes, I have a flyer that I could send over.
Awesome, great. So we'll make sure to post that flyer and share that with Trans Latina Coalition. Once again, we want to thank the state of California for funding this project and continue to be in partnership with Trans Latina Coalition and trans and non-binary community in the state of California to keep us abreast of what's going on with COVID-19. And we hope that also the state of California would be our partner as we now see the emergence of monkeypox and making sure that our community has access as part of research and is also able to get vaccinated. All right, everyone, I think that is it for our programming today. We want to thank you for joining us, and any other questions, please visit translatina.org, and we'll see you next time.